Well, good afternoon, everyone. Thanks for hanging in there. We're going to go ahead and get started now. My name is Joel Lopez, and I'm with the National Genetics Education and Family Support Center, and I'm here with Sharon.
Hello, Sharon Terry.
Excellent. And we're really excited to talk about some resources today that we've got, but quickly through some housekeeping items. Just wanted to let everyone know that this webinar is being recorded and will be made available online after. We'll be sure to circulate this link out so that folks can share this with others, and if you're not able to make it today to the live event, take a listen to it later in the future. So just a quick agenda right here. We're going to give an introduction to the Genetic Alliance and National Genetics Education and Family Support Center, or as we call it, the Family Center. We'll do an introduction and a little bit about the Advocacy ATLAS, as well as the Disease Info Search, talk a little bit about some Family Center initiatives, and then leave some time open for Q&A and any discussion that folks have.
So first about Genetic Alliance. So as I said, I'm Sharon Terry. I'm the president and CEO of Genetic Alliance. We engage families, individuals, and communities to transform health. Our vision essentially, and I won't read this whole thing, but essentially we are looking at ways that we can actually break from the traditional health settings to groundbreaking research endeavors. We're really interested in how people can come first, and especially in services that we find ways to transform health systems to respond to what people most need, or of the mind that those things are not often taken care of. And our ways of doing this are to build networks, such as the one that we're working in with you guys, deliver actual information, build some tools, and drive policy decisions when it seems critical to go there.
Thank you. And as I mentioned, the Family Center is made up of organizations who are already working with patients and supporting families as well. Family Voices, the Genetic Alliance, as well as P2P, Parent to Parent USA. And as you can see below, that we are funded by HRSA to help families develop the skills to partner with professionals and improve systems of care, assist the regional genetics networks in partnering with families and family-led organizations. We're helping with outreach and diverse to medically underserved families, and providing education and support. And some of the ways that we do this are through trainings, through providing technical assistance to the 7 regional genetics networks, maintaining and promoting online resources like Advocacy ATLAS and Disease Info Search that we're here to talk about today, and supporting partnerships between family-led organizations, the regional genetics networks, the Family Center, and the National Coordinating Center, who are all part of this big team here. And really overall, our goal is to build a network of engaged partners and develop accessible tools to improve access to and the quality of genetic services through this program. And really just wanted to remind everyone in talking about these resources that we're really here approaching the work with a community in a way that we want to connect individuals with the service and support that's already out there. We know that sometimes finding this information can be difficult. And so really our approach is working with this community to identify and capture tools and resources, making those resources easy to find and access as possible, and really helping to empower the community so they can use these resources and share them with others. And so the first one I'm going to talk about today is the Advocacy ATLAS. So a little bit about the need. We did notice in our landscape assessment that was done when we were developing this tool, we know that being an advocate for yourself or another person with a genetic condition or other condition can be hard to do. Really, the why behind Advocacy ATLAS came from the fact that although there's lots of great resources available to support individuals and families and caregivers, it can be difficult to navigate, and oftentimes these resources are located in all different places. So we know that them being spread out and folks maybe not knowing exactly where to look for them, that can take a lot of time and a lot of really commitment to look through those things. And so we really wanted to address this need to try to put things in one place so that they're easily accessible, and take some of the guesswork out of what these resources are by looking at them, coming up with a standard criteria for inclusion, and then sharing that with folks. And so Back in 2013, Genetic Alliance, Family Voices, and Parents Who Parent USA, some of the same groups that you see here representing the Family Center today, came together to reach out to the community to try to combine these resources through an online toolkit. And so they compiled resources through their combined network of parents, patient advocacy groups, disease advocacy groups, disability groups, and other partners. The group conducted outreach to solicit resources from the community and came up with an inclusion criteria to make sure that there was consistency in the criteria in which resources were included. Advocacy Atlas was launched in October of 2013. And you can see off to the side some examples of photos that were submitted for inclusion, but we've also got, not included on this slide, but available on the website, some great stories and firsthand patient accounts that were shared with us. And so I really like to show this to folks that we, not only in the resources, worked with the community, but also with the photos and kind of the more branding and marketing elements that are available on the site. And we really are happy to be able to do that. So what is Advocacy Atlas? Atlas stands for Accessible Tools for Leadership and Advocacy Success. You can see in the image to the right that based on all the great resources we received when we put this together, that we were able to put together 10 categories, and you can see all the way up the top right, from legislation and political action, all the way down to the bottom right, you've got youth leadership. I mentioned before, our goal was really to develop a single source of resources from the community with tools, strategies, and personal stories to help improve the confidence and skills around advocacy and to empower individuals. I've got up here that it is a living and growing resource, and by that I mean we're always looking for new resources to include, for updated resources. We make sure that if there's any broken links that we can either remove those links or hopefully get new updated links to replace those resources so that we can make sure that everything is accessible. And as I mentioned before, the tools and resources were really pulled from a large combined network of parents, of patients, of advocacy groups, disability groups, and other partners. And I would encourage anyone who might be listening in to the call today or to the recording, if you have any resources, I've got my contact information at the end of this presentation. We'd be happy to take a look at your resources and include them in this resource. So this is just a little by the numbers of the Atlas. So you can see that we've got 10 topic areas that contain more than 220 resources. Over the last year, there have been more than 2,600 people who've accessed the Advocacy Atlas and its resources. You can see here we've indicated the top 3 topics that we've had the most interest in, and this is by traffic to the resources on the website itself. So communicating about your health, access to healthcare, and insurance and financial assistance were the top categories, which really matches along with the trend of things that we've seen and heard from working with patients and families in the real world. And recently, over the summer and spring, we conducted a refresh and added more than 40 new and some updated resources to the Atlas. And we do plan to do another proactive push at the end of 2019, as well as the beginning of 2020, to try and get some more resources. And we also find that as we do the outreach to get new resources, it's a good reminder to folks that this resource exists, so that you can all share it with your networks and make sure that these tools are in the hands of the families and patients who need them. So we have this section included on the upfront of the Advocacy Atlas, and I just wanted to take some time really quickly today to go over our criteria for inclusion on the Advocacy Atlas. And really this is so everyone can see the kinds of things that we look at to make sure that we have a consistent quality of resources on the Advocacy Atlas. And so there are 3 main things. We've got relevance. We consider whether it's up to date, not outdated information. Our consumers, families, and individuals, the target audience for the resource. As far as content goes, we'd like it to have first-person language or make sure that the content is easy to read in terms of a low reading level and having accessible language. We do make sure that the content is evidence-based or considered a best practice, and if so, that there's citations or references linked throughout. And does the resource align with the vision of inclusive community and the other goals of the Advocacy Atlas resource? And then, of course, there's format. Is it easy to navigate? Is it free to access and available online? And so we just wanted everyone to be able to see the kinds of things that we're looking at when we receive resources for inclusion in the Advocacy Atlas. And as I mentioned, this is also available in the About section of the Advocacy Atlas on the website. I also thought it would be important to share how different stakeholders are utilizing the tool. So as you can see, really our primary audience of individuals, caregivers, parents, families, utilizing these resources to help educate them and empower them to advocate for their needs or the needs of a loved one. Also sharing the resource with their community to put the resources in the hands of as many people who need them as possible. We see healthcare providers and care teams using them to refer patients to as a supplement to a care appointment. So, for example, if someone had some questions or was seeking more information, we see these resources as a great thing to provide someone to go home with some reading material. Also communicating the resources with colleagues, other healthcare providers who might be able to share these with their patients as well. Disease-specific and advocacy organizations, health systems, universities, and other organizations, we see them as contributors to the resource. As I've been mentioning, we are always looking for new resources, and so we really rely heavily on the community around us to provide those. We see these partners as also an avenue to get the word out about the Atlas and the broader network, and also really letting other organizations know about the opportunity to provide resources and also to share this resource with their networks. Now we'll be moving on to Disease Info Search.
All right, happy to tell you about Disease Info Search. We are delighted that we're able to share this resource with you in its updated and renovated manner. So Disease Info Search actually began as a printed directory in 1987, and it was called the Directory of Genetic Support Groups. Joan Weiss, who was the executive director and the founder of Genetic Alliance in those days, had the idea that it would be good to put all these genetic support groups in one directory, and this was well used, especially by genetic counselors. It wasn't because the internet didn't exist. It was not distributed widely. It was, however, mailed to all the genetic counselors in the country and many of the genetics programs. And so we recall fondly in those days that the genetic counselors always thanked us very much for that. Around 2005, I actually coded it myself in HTML on its first web-based platform, putting all the information from the directory into a web-based platform so that people could access it. The internet was not quite robust then, but at least it was useful enough. And then around 2002, it moved to its own URL. And during those years, Disease Info Search got its name, for example, moved from the Directory of Genetic Support Groups to using greater crowdsourcing. So in other words, although in the old days we did contact all the support groups ourselves, in this newer rendition around 2012, we were able to give the support groups themselves login so that they could go in and change the disease description as it was updated and as new things were added, to link to lots of other resources, which I'll demo for you in a moment. The idea being that particularly for the rare diseases, but this does contain, by the way, common and rare, so 10,000 diseases are in here. It was very important that we get up-to-date information, and that doesn't always come from a another online service. Even it doesn't come from things like NIH sites like PubMed, et cetera, because the disease groups themselves know well ahead of any kind of publication about discoveries such as genes and protein analysis, assays, registries, biobanks, clinical trials, and so on. So we are really using the best of both the long tail and crowdsourcing in this resource. So we have a number of partners, and those include patients, caregivers, healthcare providers, coalitions, and advocacy organizations. So our services essentially allow access to high quality, easy to digest information and resources, and these are from both public and private databases. We have partnerships with organizations like the National Library of Medicine, especially NCBI, where we've put together algorithms to bring information to folks that's more palatable to the general public. So in other words, if you went in there and searched epidermolysis bullosa or Ehlers-Danlos or spondylitis or whatever you want to pick, you would probably get hundreds of articles on mice and humans, and some of them would be old and most of them would be case studies. And so the algorithms that we've developed and the filters we've developed with NCBI allow individuals to get information that's more useful, more general. So for example, might use a review article filter, might also use a kind of currency around the last 5 years, might have other specialized filters on it if the disease group has given us some of those. And then this would be a place that individuals could find resources like national support groups or international ones, news and events, trusted disease-specific information, clinical trial info. Clinicaltrials.gov is another place that we've done filters so we don't get, for example, out-of-date trials or trials that are not really relevant. Some of the trialists list diseases that they're not really doing any study with, but they're related, and so we filter those out. And then to drive individuals, health professionals, and researchers to an organization. So in other words, when you list with Disease Info Search, you're very available to the health professionals and the researchers who are working on the condition, obviously, and then individuals find us both through natural search as well as through professionals advising that individuals should search. Certain data fields can be pulled through API. So we have some partners that actually pull information from Disease Info Search, or all of it, onto their site. We have a tiny Intel Inside type stamp on it that just says powered by Genetic Alliance, and your organization can have all of this data come through as well. It's obviously most useful to umbrella organizations or sites that aggregate information like clinics and hospitals. And then this can also be integrated into other service offerings. So for example, it can appear in an EHR portal. We're working with a payer for it appearing on the website of the payer. Lab reports can use it, obviously pulling up just the information that's relevant to the specific condition that someone's getting tested for. And certainly other patient portals and educational websites can use it as well. So we make this as widely available as we can. There is a fee for the API, but it's very, very low so that people can have access to this information. And the use of this site is free to all individuals, clinicians, et cetera. The idea of bringing it through onto your site is where it actually would cost something. So quality information on more than 10,000 diseases, including, again, support organizations, resources, clinical trials. I'm going to try to go live online here. We'll see how this goes. Sometimes it works and sometimes it doesn't. So when you do get the slide deck, it will have slides in it that show you this. But for example, I can put in a, sorry, I need to share my Safari. Great, okay. All right, so there's the search box. It's a smart search, meaning I can start to type. It will actually even correct my typing if I'm wrong. I'm going to use Duchenne muscular dystrophy as an example. But for example, if I put in something like the beginning of pseudoxanthoma elasticum, which is the disease my kids have, you can see lots of pseudos come up, and I would have to go farther to start to limit this list to pseudoxanthoma. And I think I'm getting a little lag here, so I'm going to back out of that and go back to Duchenne. All right, so once I've discovered a match, I simply click on it. You also saw that I could search just by the alphabet as well as if I wanted to. And so what this brings us to first is a disclaimer that basically says this is not medical information for you to use. It's even not intended to educate a patient, be used in a patient-physician relationship, but it is, and it's not a substitute for professional diagnosis. So I'm going to close out of that. Essentially a little preamble, and then we come to a whole bunch of important things, like a description of Duchenne muscular dystrophy that was written by Parent Project Muscular Dystrophy, the major support group in this area. And so this information we know is current, it's relevant to families and patients. We also can go from here to looking, so this is the overview block I'm in. If I go to the Find Support block, I see that I have chosen by default the disease support groups that are important in this area. I can also add all the general support groups if I want, and I can parse these by what kind of support services they do offer. Those, again, are all entered by the advocacy group themselves, and so they're up to date and current, and so I can start to look at what of these organizations are available to me. And then if I go to news and events, I can look at some of the latest news. This is actually coming in from a filtered Google News search that sometimes the support groups have filtered and sometimes we have done as well. Clinical trials, Duchenne is certainly one to pick because it has 58 trials right now. It's among the most common conditions to have trials. But you can see I also have the opportunity here to filter further right here. Maybe limiting this to the United States. It's now pinging the clinicaltrials.gov database, and it's updating to say only 27 of the trials are in the United States. Then we come to publications, and as I mentioned, these are review articles that we find in Duchenne muscular dystrophy, and then I can even go further. We do make sure that the review articles we serve up are free. We know that hitting paywalls for parents and even for clinicians who don't have access to large libraries is very difficult, and so we're looking here at both the opportunity to look at free ones and then if one wanted to expand further into the paid ones. And then we have an opportunity for people to participate. Often there might be a survey here that Genetic Alliance is parlaying. We've often served up other surveys for HRSA and other entities. And if there's not one particular one, then what we put here is our peer platform for engaging everyone responsibly, web-based survey system so that we can gather information. Sorry, that's not loading very quickly because I think my connection here in the conference room is pretty limited for some reason. So there also are all sorts of admin features. So if you wanted, for example, to list an organization, that's possible right here. And if you wanted to understand how to get started using this, you could, and then certainly to contact us as well. So we have for the patient a lot of information. We have for the individual clinician a way to give people information. And then for the support groups, we have a way to advertise yourself, so to speak, or get your name out further. And then these slides that you'll see in the deck are simply ones that are static for the kind of thing I just showed you. I mentioned that we have APIs, and so, for example, Global Genes uses an API from us, so you can see this looks slightly different. It's the same information coming through on diseases that are of interest to them. They limit themselves, obviously, to the rare diseases, and so they can filter our database, so they're only bringing in the rare diseases. And you can see the tiny Powered by Genetic Alliance logo there, so that we're really wanting the group that's using the API to be the predominant brand here, and we're not interested in over-branding or equal-branding. The API is easy to use if you're a developer coder. We have extensive documentation on it, so we have all the information that someone needs in order to get started. And it's easy, again, for developers to use this to get the API rolling. Disease info search by the numbers, we have about 12,000 active users per month. We are not yet advertising, so to speak. We haven't kind of gone out with a big outreach or a big advertising communications program. That is beginning. We're doing that in partnership with Global Genes. So we imagine that these numbers will increase drastically. I should also say that all of the diseases in PubMed link to disease info search. So we have a linked out feature from PubMed. So you might be searching a disease, or a researcher is, or a family is, and there is a button that they can click that says link out, and it will link out to disease info search, and they'll find your support group quicker than maybe other ways. And again, more than 10,000 diseases and about 800 advocacy groups are active in the portal. I'll turn this back over to Joel.
Awesome. Thank you, Sharon. So I wanted just to briefly look at some of the other resources that we have developed here at the Family Center. The first I wanted to mention, I've got a couple screenshots of the organization, of the organizational guide, but here's a look at the resource we developed for each of the 7 regional genetics networks. It's a helpful reference for the regions as well as for families that they work with within the regions to understand and identify the family-led organizations that exist within those regions. And so really as a tool to help the regional genetics networks better understand the partners that they have in their region, and to remind them that those family organizations are there to partner with them and to provide support, especially when it comes to outreach to diverse and medically underserved communities. We wanted to make sure that we had this list for each of the regions specifically so they could know where to look and where to go for support, knowing they can also come to the Family Center because one of the functions we serve is to make those connections, but thought this was a great reference guide, which is available through all of the 7 regional genetics networks individual. And we've created a guide, one version for the regional genetics network staff, as well as a version for families and caregivers to have with them so that they can know local and regional organizations that are family-led that exist in their area as well. Also wanted to give a nod to another one of our educational websites, which is Genes in Life. This is a consumer-facing website that really provides some great information on how genes and genetics impact your everyday life. And so we've got kind of the Genetics 101 as well as some more in-depth information for people who may have received a diagnosis, and also link, of course, to some of the resources that we've mentioned today earlier through this site, and have some blog posts. So encourage folks to go take a look if you're interested. We've also got a number of other initiatives by the Family Center. We develop tailored programs and products for regional genetics network staff and families. For example, the regional reference guide that I mentioned would be a good example of a tailored product for a regional genetics network that we've partnered with them to work on. We promote patient and family engagement as partners in care by working to involve family members in the working groups, and also collaborating with the National Coordinating Center for the Regional Genetics Networks, as well as the regional genetics networks that I've mentioned here a couple times. And then providing ad hoc assistance. This can look different based on the needs that the regions have, but in some cases this might be strategizing around getting a survey out and maybe disseminating the results of that survey. We've worked around developing educational videos, fact sheets, other materials like infographics, and really work to make sure that there's a patient-centered approach that's brought into these things and really keeping our core values in the middle of the things that we do here. And with that, I will open things up to questions. If anyone has any questions, I know we've got a text box. You're more than welcome to type those questions in, and we're capturing them here. And we'll be happy to respond if anyone has any questions.
Okay, so the question is, what happens when the disease you suffer from is so rare that it doesn't even have a name? For example, I have a genetic mutation in my STAT1 protein, and this mutation causes primary immunodeficiency disease, as well as multiple autoimmune diseases. So, great question, and it's one that we're constantly looking at. I neglected to mention that actually the diseases that are listed in Disease Info Search come from and are created in collaboration with a whole host of other disease listings. So, for example, the GARD, which is the Genetics and Rare Disease Resource Center, OrphanNet, which is Europe's and some other countries' collective, UMLS, SNOMED, OMIM, which is kind of the Bible of rare conditions. All of those are consulted. All of the diseases on the back end are tagged by those databases, and they're given the proper numerical connections. So when we come upon a disease that does not even have a name yet, there is a process by which diseases are accepted, so to speak, as diseases. And you can imagine these are happening at a mad rate, trying to determine whether every mutation that causes a different phenotype should be tagged as a disease or not. Those kinds of conversations are happening on national policy and international policy levels. We're working with the WHO on ICD-11 and looking at what diseases will be tagged in that system. So what we do is we look carefully at all those databases. We discuss it with our colleagues at the various centers like the National Library of Medicine, like GARD, which is part of NIH, with our colleagues at OrphanNet, et cetera, and decide together what to do. The idea being that we don't want to be listing everything now that comes across any of our desks, because that would really create a kind of chaos that a lot of these standards, nomenclatures, ontologies are trying to take care of. And so once we do determine that, in fact, together we are accepting that this is a new disease, we then ask the support group for that disease to put the listing in. Sometimes there's not a support group for a disease, and we will work with smaller entities like groups of parents, et cetera, as they work toward becoming a disease group. But we also have to be careful there that we're not just willy-nilly accepting information from whoever. And generally, we do look at what is the criteria for inclusion, and there is one. Generally includes 501c3 status, a professional advisory board, et cetera. So, and we make exceptions, as I said, but we are trying to look at ways to make all of this more standard. Hopefully that's an acceptable answer to you. I know that I'll say this on a not so much the professional level, but on a human level, it can be really, really tough when not only do you have a rare disease, but you're one of the only people in the world with something that has no attention. And we're really trying to figure out how to pay attention to that and give you the support you need, and also to allow you and others to post the things that might help others.
Yeah, it looks like we've got a question on going back over how to find the RGN reference guide for local orgs. So as I mentioned before, there's 7 regional genetics networks that have been set up. The Family Center is a partner to this public health initiative in which HRSA has designated states into regions. And so each of the regions has its own website, and on that website, the regions host the regional reference guides. But if you are interested, I'm happy. We'll go to the next slide that has my contact information. And if you want to reach out to me, Joel, I'm happy to identify the region that you'd be affiliated with based on your state, and then can direct you to that website, as well as to who the appropriate contact would be to get in touch with the region. And I also see a question about the slides being available. If they will be available, yes, we will be sending the recording out, and I can make sure that the presentation slides are also made available. We can give folks just one more minute if there's any other questions. But I really want to thank everyone for joining us today.
And certainly feel free to reach out to us. You can see our email addresses there. We're pretty easy to find, and we're happy to answer any questions in the future as well. Anything else, Joel, before we sign off?
Yeah, it looks like a couple people have their hands raised. So if I could get you to type your question in the question box.
How are the clinical trials sourced? Terrific question. So the clinical trials are sourced through clinicaltrials.gov. What we do, though, is overlay in the background some filters, which, as you saw, you can actually remove or increase or decrease yourself. But the ultimate sort of goal here for us is not that people are overwhelmed with irrelevant or closed or inaccessible trials, but in fact are seeing trials that are open, trials that in some cases we do localization for. Most cases we leave pretty open because sometimes particularly people with rare diseases are willing to travel or at least have to travel to get to trials. So those are really well curated. We've also tried to database them better than clinicaltrials.gov itself does, although it's moving more toward a database structure, which is quite helpful. And then another question, diseases can be organized into categories based upon the microbiological pathways affected. Are you also working upon an effort to categorize diseases based on these pathways? Yeah, so we are actually using a whole host of those sorts of sorting, tagging in the background. And some of those we've opened to the public to see, and others we have not. So we've opened, for example, being able to see that something's a rare disease or not. Others, yes, in the case of conditions that need to be aggregated one way or another for either research communities or clinicians in the background. When the group enters the information about the disease, they also use a whole bunch of tags, and they also can create tags. One of the things that's very important in working on databases is that you can have an infinite number of tags and ways to sort, and then it becomes moderately useless. So we keep looking at how many tags do we want to have, how many categories do we want to have, whether we're in fact going to be able to tag things by pathways, et cetera. We're also working hard right now on dovetailing disease info search with our platform for engaging everyone responsibly. So we have a registry platform that is built on one that I built 24 years ago. The one we have currently is 10 years old, and it can, for example, bring up similarities between diseases, pathways, symptoms, signs, et cetera. And eventually, we're not there yet, we'll want that to populate disease info search as well. So for example, when you look at a condition, you might in fact see that these are the top 5 common symptoms in that condition, and there might be ways that you want to contribute further to either posing some questions because you have a lived experience of the disease, and we believe ultimately those are the experts, or you may want to explore something that you see as underserved in the condition you have. So the combination of those two, we hope, in a kind of informed and intelligent mashup will be very useful. We're probably a year or 2 away from that, though.
Great question. What is the website for ATLAS? So that's on the Genetic Alliance website, geneticalliance.org/advocacy-ATLAS.
Okay, so the curated list of only open relevant trials is also available through your API. Yes. You might want to directly go to clinicaltrials.gov and see if they would give you an API into their website with the same sort of curation. I'm not sure. I think they kind of are pleased that we take care of some of these sub-APIs, but yes, it is available through our API. Yep. And then another question. We're just seeing whether Joel or I will answer this. It's for you, Joel.
All right. If you are a researcher, clinician who has created printed materials for patients based on patient and family interactions, but these resources online, I think that might mean the resources are not available online. Can we still share these resources with Genetic Alliance for Advocacy ATLAS? Yes. If you can scan those to me, we actually have a number of resources that were sent to us that we host on the Genetic Alliance website, but still attribute to other organizations that provided those resources. So I would say it might be the first that we have gotten in a fax or scanned form, but we would definitely be happy to include that resource. If you want to send me an email, jlopez@geneticalliance.org, with a digital version of that file, we can make sure it gets online and is available through the toolkit on Advocacy ATLAS.
And you can also, if it's either disease-specific or related, for example, to a population like children, you can put it on disease info search in the relevant place as well.
Excellent. Well, it looks like we are through all of our questions. So again, thanks everyone for joining. Really appreciate your time today, and we will.
Oh, we have another question.
Last question.
So this is a fabulous question, and I love retinal disease questions since PXE is also a retinal disease. And so the question's asking, do we work with groups to develop national standards of care for individuals diagnosed with, for example, retinal disease? 70 to 80% of our patient population was living with a different diagnosis until genetically tested. So that is a great question, particularly for Genetic Alliance. We definitely are continuing to look at how do we improve diagnosis. Both Advocacy ATLAS and Disease Info Search, I think, contribute to those things. And then we think there's real policy issues. So we have in the past given webinars and workshops on, for example, national standards for care, guidelines for specific symptoms. And we're happy to work with groups on that sort of thing. We've had funding from HRSA in the far distant past, and we don't have any funding right now that is specific to that. But it's certainly something that I think the regions and Genetic Alliance is interested in, and something we could probably look at trying to find funding to do. It's quite a formal process to actually develop guidelines and national standards. But I think that, again, we look to how do we long tail something like that and make it accessible to many groups to do, rather than sticking with just the formerly historical and fairly expensive ways of doing those without losing the quality of developing such standards. How do you plan to connect with NIH as all of us? So this is Sharon Terry again, am one of the founders of the All of Us program. Worked with Obama and Francis Collins on it, and then I serve presently on the advisory board for All of Us. So we are in constant contact with All of Us. Today, 3 or 4 emails back and forth. They are not yet prepared to or have connections to communities that aren't among their grantees. So they have about 60 or 70 different vendors, communities, et cetera, working with them. And they are continuing to gear up to do things that are more, let's say, organic or innovative. So they haven't found a way to work with us. We certainly had hoped they would by now. And we know that it's a yeoman's job to set up a program that will register 1 million people and their information and eventually their genomics and genetics as well. So we have great hope that we will be working with them. Our platform for engaging everyone responsibly, peer individuals can indicate in that platform that they do in fact want to cross-register with other endeavors like All of Us or the UK Biobank, et cetera. Most of these big national, international efforts are fairly siloed in the sense that their walls are pretty impermeable, and right now we don't really have a way to connect with them. We are built, though, our architecture is such that we hope one day, if their walls become porous or if they have APIs, for example, that we can have bidirectional activity with them. But we do keep that very much on our radar, and I am well apprised of a variety of things and also trying to influence policy left and right to make things more grassroots than top-down. Okay, looks like we have reached the end of our list, I think, this time for real. But we're happy to
we're happy to answer these questions. But thanks for everyone who had a question. Again, thanks for everyone taking the time to join today. We will be circulating the recording and make sure that the slides are made available as well. And we encourage all of you to visit these great resources and share them with your communities. And as I continue to mention, if you have anything you'd like to include in the Advocacy Atlas, please reach out to me.
All right, thank you all.
Take care, everyone.